going to introduce the global scope and scale of maternal malnutrition. The Healthy Mothers, Healthy Babies Consortium is one of the programs that is part of the Micronutrient Forum, and you can see the other programs that are under the Micronutrient Forum. And using the Healthy Mothers, Healthy Babies program, we try to elevate the plight of mothers. We try to advocate for the role of micronutrients as far as fighting for maternal malnutrition is concerned. Now, globally, many women lack the adequate nutrition. And we know that there are three major indicators that we use to assess the health of a mother, or of any human being for that matter. And so one of them is low body mass index. And underweight pregnant women face a greater risk of preterm delivery. And when we look at that particular metric, 170 million women, or 1 in every 10 women of reproductive age, are underweight. Now, the other metric that we like to look at is, or other indicator that we like to look at, is anemia. And we know that children born to anemic mothers are more likely to be born too early or too small and face an increased risk of being sick or even dying. So when we ask ourselves how many women globally are suffering from anemia, the numbers are just staggering. So 570 million women, or 1 in every 3 women of reproductive age, are anemic. And that translates to their baby, and that translates to the possibility of the baby getting sick or even dying. And when we zoom in to some specific regions, and then we use, say, the Southeast Asia, to explore the third indicator that we like to keep an eye on, which is stunting, or what we call being short for your height, or being of short stature, we notice that the numbers are also significantly staggering. So 35% of women in Southeast Asia, and this is largely what you would find in other regions, for example, like Africa, the numbers would not be very different. You find that women would be short for their height, or would be of short stature. And this being short leads to serious risks of, in terms of the woman's health, and increases the chances also of their child being born also stunted. And this fuels the intergenerational cycle of malnutrition. And so women also lack access to quality health and nutrition. Globally, many women of reproductive age have not, over successive generations, had what you would call an ideal diet, an ideal access to health and nutrition. And the COVID-19 pandemic has also come in to compound this problem. So first, 38%, only 30% of women currently receive 90 or more iron and folic acid tablets during their pregnancy. Now, this has been what has been recommended, but we see that the number of women accessing what has been recommended before is abysmally small. Then only 59% of pregnant women attend 4 antenatal care visits. And for those of us who are in public health, we know that since 2016, the World Health Organization recommended that actually pregnant women should make at least 8 antenatal care contacts. And this further increases the gap of women not being seen by a skilled professional like a nurse or a midwife at a healthcare facility. Each year, 20 million babies suffer from low birth weight, which is an early marker of poor maternal and fetal nutrition. And then, as I said, COVID-19 has come in to complicate the scenario, because now it's leading us to other worst case scenarios. If I can just quote some of the data that we are receiving from one of the programs at the Micronutrient Forum, which is a Studying Together for Nutrition Consortium, they project that there will be an additional 283,000 child deaths over the next 3 years, which translates roughly to 250 child deaths per day. Also, 13.6 million wasted children with high risk of death, an additional 3.6 million children with lifelong physical and cognitive impairments due to stunting. And when your child is cognitively impaired, that also impacts their life earning potential. Further, 4.8 million more women afflicted with anemia. So these numbers are what make us spend sleepless nights wondering, what can we do about this situation? Now, poor maternal nutrition has dire consequences for communities and the world. And we know that poor nutrition in infancy and childhood leads to economic disadvantages for the individual, and this would last for over 30 years and would affect their families and also the generations that come after their families. Well, simply put, if you're not of poor nutrition, then you don't go on to achieve your highest education potential. Then you can't, for example, access the kind of job that you would ideally have accessed. That impacts your income earning potential, your family is impacted, generations from there are impacted. And so the reverse is true. Good nutrition is linked to improved school performance, increased productivity, which leads to long-term economic benefits on individual, and then collectively for a nation leads to better GDP, better development for a country, and therefore also for the globe at large. We are much better off when everybody is of good nutrition. And so investing in nutrition has been shown that it could reach 5.7 trillion US dollars per year in economic gains to society by 2030. Now, improving maternal malnutrition is possible when we invest in women and deliver a package of evidence-based maternal nutrition interventions. And we are doing this, trying to meet some of the goals that have been put out there. We all know of the 2030 United Nations Sustainable Development Goals, where we have made a commitment to tackle undernutrition and hunger by 2030. The World Health Assembly has also given us very ambitious targets that by 2025, most countries have endorsed the World Health Assembly Plan on Maternal, Infant, and Young Child Nutrition, which specified 6 global nutrition targets. First, we are supposed to achieve a 40% reduction in the number of children under 5 who are stunted. Then a 50% reduction of anemia in women of reproductive age. Achieve a 30% reduction in low birth weight. Ensure that there is no increase in childhood obesity, because malnutrition also means obesity is also part of malnutrition. We are supposed to increase the rate of exclusive breastfeeding in the first 6 months up to at least 50%, and reduce and maintain childhood wasting to less than 5%. So multiple micronutrient supplements, which, as I said, in some places are referred to as prenatal multivitamins. For this presentation, I'll refer to them as MMS. These are one of the most impactful nutrition interventions that significantly improves maternal health and birth outcomes. And we know this because most diets out there are poor in the sense that they cannot supply all the needed multivitamins or multiple micronutrient supplements. And therefore, this package provides all that a pregnant mother would need in one small intervention. And therefore, it's a unique window to help us stop the intergenerational cycle of malnutrition if we can prevent the mother and the baby from being sick and possibly even dying. So the question is, what is multiple micronutrient supplementation? Now, the WHO, or the United Nations, calls it UNIMAP. The long name is the United Nations International Multiple Micronutrient Antenatal Preparation of Multiple Micronutrient Supplements. That's what UNIMAP MMS stands for. But we largely normally refer to it as MMS. It has 15 essential vitamins and minerals for pregnant and nursing women, and meets micronutrient requirements that poor diets cannot really meet. And so previously, what was recommended was iron and folic acid during pregnancy. Now, WHO has recommended MMS in the context of rigorous research. And what is given is, or rather the recommended dietary allowance for MMS is just one, for example, 1 capsule, 1 tablet per day. And then the woman would get all these 15 essential vitamins and minerals. And these are all the documentations that have been released in support of MMS in various settings. So, and this has come after decades of research. A World Health Organization released a very context-specific recommendations, including in populations affected by an emergency and or experiencing an active tuberculosis outbreak, or in other contexts are supported by rigorous research. And as of last year, MMS is now in the WHO essential medicines list, which basically means that now countries can also add MMS into their essential medicines list at country level, and their government and public health stakeholders can go on to recommend MMS to their populations. So in summary, MMS is effective, is safe, is affordable, and is cost effective. And if we adopt MMS, the global impact will be significant. If we transition, if a country, for example, if all countries manage to transition from just iron and folic acid to multiple micronutrient supplements, we will be able to avert between 7 to 28 million additional infant deaths and disabilities across 32 lower and middle income countries. Scaling up multiple micronutrient supplements to 90% coverage is projected to contribute to huge human capital gains for all babies born per year across 132 lower middle income countries. And this will add at least 5 million additional school years. And in terms of cumulative lifetime income, we will be able to add 18 billion US dollars.